Today we'll be going over the rotator cuff strain and the hops on the field evaluation for it. A rotator cuff strain is the overstretching of tendons in the rotator cuff causing acute injury. Injury is often caused by long-term use of that tendon. For the history portion of the hops on the field evaluation, you need to ask open-ended questions. Onset of this injury is usually acute but can be chronic if the person has ongoing shoulder issues. It causes pain in the shoulder and upper arm. Mechanism is the overextension of tendons in your rotator cuff. Predisposing factors can be like frequent dislocation of the shoulder that may increase chances of a rotator cuff strain. For the observation portion, you need to tell what you observe on the part of the body that is injured. So this one would be your shoulder. Pain and the weakness in the shoulder are one of the few visual observations that you can see when dealing with a rotator cuff strain. If the strain is bad enough, there might be slight swelling in the shoulder, but none very present or very visual, I guess. For the palpation of a shoulder strain or a rotator cuff strain, the palpation of a rotator cuff can be done by feeling the supraspinatus and the infraspinatus tendons in the shoulder, which will be sore or tender if it indicates any abnormalities in the shoulder. Palpating the anterior side of the shoulder is done by feeling the teres minor muscles group, which will cause tenderness or soreness as well in the shoulder if there's any other abnormalities. Any special tests to test out if the patient has any problems with the body part y'all are facing and the hops on the field evaluation. The drop arm test is performed by abducting the arm level with the shoulder plane, and once you passively lower the arm, if the arm drops to the side without resistance, that indicates a rotator cuff abnormality. Thank you.